Hello, my name is Alex and I'm a spokesperson for the CDC representing the Philippines. Before we get on with questions, let's go over the vital statistics. The Philippines has a total of 732,000 cases of COVID-19. During the time span of this epidemic, which started in January up until now, there have been about 13,200 deaths and about 603,000 of these cases that have recovered. On account of vaccinations, 146 million patients have been given the first dose, and about 53 million are fully vaccinated. Measures to prevent spread have been taken. Face protection should be worn when going outside or around people, and people should maintain social distance of about 6 feet apart. Those who have their immune system compromised, chronic diseases, and those who are over 60 are at higher risk for contracting the COVID-19 virus. We are looking out for new variants like the South American variant and the Brazilian variant. Screenings have been placed in Metro Manila, Luzon, and Visayas. The vaccines we are currently using are Pfizer, Moderna, and Sinovac. Those who have questions are now free to ask. You say that people with chronic diseases are at a higher risk. What about those with genetic disorders? Based off the study done by the United Kingdom back in October 2020, those with Down syndrome are 4 times more likely to be hospitalized after contracting COVID-19. It's safe to say that people with genetic disorders such as Down syndrome have a higher risk of getting hospitalized after contracting the COVID-19 virus. What is your risk assessment based off your demographics? We started by gathering the general idea of what the symptoms would be. Most of the symptoms are similar to symptoms that you would see in a common flu, such as fatigue, muscle soreness, etc. However, there have been some different symptoms that we have seen, such as loss of taste or smell. After we took a look at the cases and those who have been affected, we found out that most of the cases of COVID-19 are patients whose ages are over 60. That's when we decided that senior adults were being targeted and are at higher risk for contracting the COVID-19 virus. Based off our findings, we managed to find out that this COVID-19 virus was spread through air droplets. Measures have been taken, and those who wear face protectors and make sure that they sanitize wherever they go have a lower risk and prevent the spread of a virus from them to another. How are you currently distributing the vaccine? We are currently distributing the vaccine through drive-thrus and vaccination sites. An example for the location would be in Metro Manila. Along with testings, they have vaccination sites as well. This concludes today's briefing. Thank you for your time.